differences between voiding dysfunction and overactive bladder, to a certain extent, they overlap. By far and away, the most common source of voiding dysfunction in men, especially as they get into their 50s and beyond, is benign prostatic hyperplasia, or BPH, commonly known as an enlarged prostate. This happens almost universally in men. The symptoms vary from man to man. Generally, the symptoms associated with BPH are, number one, the obstructive class of symptoms, which are a weaker stream, straining, hesitancy, starting and stopping your stream. Conversely, the other subset of symptoms are symptoms that can be overactive bladder symptoms, such as urinary frequency, nocturia, or peeing frequently at night, having significant amount of urgency. Now, the confusing thing here is that a man can have overactive bladder symptoms with or without BPH, although most commonly, men, as they mature, if they're having overactive bladder symptoms, it is probably because of BPH. One of the confusing things is that the treatments for BPH and overactive bladder are quite different. And in fact, some of the treatments for overactive bladder can make your BPH symptoms worse. So it's very important to be able to ferret out the differences and the intricacies of a man's voiding difficulties or urinary difficulties so that he can best be treated.